Hello and welcome. Today we're diving into the complex world of paraneoplastic neurological syndromes, often abbreviated as PNS. These are rare disorders that affect the nervous system as a result of cancer, but in a way that's not directly caused by the cancer itself, its metastases, or treatment complications. Instead, PNS arise from the body's own immune response to the cancer. So, what actually causes PNS? The underlying trigger is, of course, cancer. However, the PNS are not a direct result of the tumor infiltrating the brain or nerves. Instead, the cancer cells, often neuroendocrine tumors, small cell lung cancer, or ovarian cancer, can express proteins normally found in the nervous system. The immune system recognizes these proteins as foreign, mounting an attack against the cancer. Unfortunately, this immune response reacts with healthy nervous system cells, mistaking them for the cancer cells. Let's delve deeper into the pathophysiology. When the immune system launches its assault, antibodies and cytotoxic T cells are produced that target the neuronal proteins that the cancer cells are expressing. These antibodies, like anti-Hu-Yo or anti-Ri depending on the specific PNS, bind to neuronal antigens. This triggers a cascade of inflammation and neuronal dysfunction. The resulting damage can affect various parts of the nervous system, from the brain and spinal cord to the peripheral nerves and muscles, leading to a wide range of neurological symptoms. Paraneoplastic neurological syndromes are rare, estimated to affect less than 1% of cancer patients. They are more frequently associated with certain types of cancers, most notably small cell lung cancer, ovarian cancer, breast cancer, and Hodgkin's lymphoma. The true incidence may be underestimated due to the challenges in diagnosis and the possibility of misdiagnosis with other neurological conditions. The signs and symptoms of PNS are incredibly diverse, reflecting the broad impact the immune system has on the nervous system. Patients might experience difficulty with balance and coordination, a condition known as cerebellar ataxia. Others develop encephalitis, characterized by confusion, memory loss, and seizures. Peripheral neuropathy, causing numbness, tingling, and weakness in the limbs, is another common manifestation. Muscle weakness, visual disturbances, swallowing difficulties, and autonomic dysfunction, affecting heart rate, blood pressure, and bowel control, can also occur. Crucially, the neurological symptoms often precede the cancer diagnosis, acting as an early warning sign. Diagnosing PNS can be challenging due to the variability of symptoms. It typically involves a combination of clinical evaluation, neurological examination, and diagnostic testing. Blood tests are performed to detect the presence of specific paraneoplastic antibodies. Neuroimaging, such as MRI of the brain and spinal cord, helps rule out other conditions. Cerebrospinal fluid analysis can reveal inflammation and the presence of antibodies. Electrodiagnostic studies, like nerve conduction studies and electromyography, can identify peripheral nerve or muscle involvement. Ultimately, identifying the underlying cancer is crucial for confirming the diagnosis. Paraneoplastic neurological syndromes are broadly classified based on the area of the nervous system affected. These include paraneoplastic encephalomyelitis, which involves inflammation of the brain and spinal cord, cerebellar degeneration, characterized by progressive loss of coordination and balance, limbic encephalitis, affecting memory and behavior, sensory neuronopathy, causing numbness and pain, and Lambert-Eaton myasthenic syndrome, resulting in muscle weakness. Specific antibodies are often associated with particular syndromes. Treatment for PNS focuses on two main goals: treating the underlying cancer and suppressing the immune response. Cancer treatment, which may involve surgery, chemotherapy, or radiation therapy, is essential to eliminate the source of the antigens triggering the immune attack. Immunosuppressive therapies, such as corticosteroids, intravenous immunoglobulin IV, plasma exchange, and other immunosuppressant drugs, are used to dampen the immune response and reduce the damage to the nervous system. Symptomatic management, including physical therapy, occupational therapy, and medications to alleviate pain or other specific symptoms, is also an important part of the treatment plan. Currently, there is no definitive way to prevent paraneoplastic neurological syndromes. Early detection of cancer through regular screenings and awareness of potential neurological symptoms may help improve outcomes. If you experience new or unusual neurological symptoms, especially if you have a history of cancer or risk factors for cancer, it is essential to seek prompt medical attention. The prognosis for PNS varies widely depending on the type of syndrome, the underlying cancer, and the response to treatment. Early diagnosis and treatment of both the cancer and the neurological syndrome are crucial for improving outcomes. While some patients may experience significant improvement with treatment, others may have persistent neurological deficits. Recent research is focused on identifying novel biomarkers for early diagnosis, developing more targeted immunotherapies, and understanding the complex interplay between the immune system and the nervous system in PNS. Advances in cancer treatment and immunotherapy offer hope for better outcomes in the future.